Hello everyone. Today we will be going to start with the lecture number 2 of general anatomy. Last time we have covered the normal features of general anatomy. Today we will be seeing the most important positions and all about this. So let's get started. So the position which is appearing on the screen is basically the supine position. This is called as the supine position. In this position, the person is lying on its back. The person is basically lying on its back, and majority this position is used for the surgeries such as cardiothoracic surgery, abdominal surgery, cardiothoracic surgery, and then this is the next position. This is called as the prone position, where the person is lying on its stomach and thorax. It is not lying on its back, and the back is clearly visible. This is basically used for spinal surgeries. Here, the compulsion is that the person should be lying on its abdomen and the pillow should be placed in the head region for the patient to provide it comfort. And after that, then we have seen this position. This is called as the fundamental position. In this position, the person is standing normally, just like the normal anatomical position. But here the hack is the hands are not facing forward, but the hands are facing medially. They are not facing towards the forward. So that is the difference between the normal anatomical position and this fundamental position. For that, this is the new position. This is lithotomic position. Here, the person is lying on its back. The person is lying on its back with both the foot supported with the help of footrest. Here you can appreciate this is the footrest, and this is the foot which is lying on the footrest. And it is generally used for treating the obstacles and gynecological procedures, as well as this is used for genitourinary surgeries. Genitourinary surgeries. After this position, we have the lateral decubitus position. In lateral decubitus position, the person should be lying in the lateral side. In one side, it might be left, it might be right, but the person should be lying on one side of the body. And this position is best for ear surgeries. This position is best for ear surgeries. That is called as the lateral decubitus position. After this, we have this normal anatomical planes. So there are five types of plane in which we can dissect the body. The name of the first plane is mid-sagittal plane. What happens in this plane? You can see this blue color plane, which you can appreciate in this image. So this is basically the mid-sagittal plane. In mid-sagittal plane, the body is divided into two halves, two equal halves, right and left. Here I will show you, this is the image, and I will show you how it is getting divided into two equal halves. So see from the middle, the body is getting divided into two equal halves, and this is called as the mid-sagittal plane. Here we can write this as plane that divides the body into equal right and left. This is the mid-sagittal plane. Then the another plane is the sagittal plane. The sagittal plane is same as the mid-sagittal plane, but there we will get two unequal halves. In mid-sagittal plane, we used to get equal halves, but in sagittal plane, we will get unequal halves. And the point that you should be remembering is that the sagittal plane is always parallel to the mid-sagittal plane. So here we can write that sagittal plane, it is parallel to the mid-sagittal plane, but right half is not equal to left. After that, we can say there is the third plane, that is the coronal plane or frontal plane. In this coronal plane or frontal plane, we basically divide the body into two halves, that is the anterior part and the posterior part. We can say it as front and back. So the plane that divides the body into anterior and posterior is the coronal plane. You can appreciate the coronal plane in this image. This green plane which is cutting the body into two halves, the front and the back. This is the coronal plane. You can see that this plane I am showing you with my hand. This is the coronal plane. This is the sagittal plane. If I cut myself from the midline, it is the mid sagittal plane. The plane that is parallel to it is the sagittal plane, and the plane which is cutting my body into front and back, that is the coronal plane. Then the fourth plane is transverse or horizontal plane. So in this transverse and or horizontal plane, you can basically appreciate that the body is getting divided into two parts, but it is the upper part and the lower part. In this image, you can see this is the red color plane that I'm showing you. This red color plane divides the body into two halves, that is the upper half and the lower half, that is the transverse plane. In transverse plane, we can write it as the plane that divides the body into upper and lower part. And the last plane that we are studying here is the oblique plane. This oblique plane, you can see here, I'll show you on this person, that whenever the plane is making an angle with the ground, this like this, then it is called as the oblique plane. Oblique plane. Then we are moving on to terms in gross anatomy. These are basically the fundamental terms that you should be knowing while studying anatomy. If you don't know this term, it will be hectic for you to understand the other parts of the anatomy, but I'll teach you, so don't worry about that. You will be getting it. The first terminology is anterior. What is anterior? The anterior part is just the front. This is the fancy name for front, the anterior part. So the front part, which you can see, this is called as the anterior part or the anterior plane. The behind part, which you can appreciate, is the posterior part. So anterior and posterior work oppositely. Anterior is the part which you can see from the front side, and posterior is the part which you can see from the back side. Then there are again two terms, that this is superior and inferior. Superior is just basically the top part. The part which you can see on the top is called as the superior part, and the part which you can see on the downside, it is called as the inferior part. So anterior part, will just write it as front of the body, front of the body. Posterior is just the back of the body, back of the body. Superior is basically the top of the body, towards the top of the body, and inferior is just towards the bottom of the body. Then there are two terms, which is medial and lateral. What is medial? What is lateral? So we'll say that this is the mid sagittal plane. Just for a reference, we'll take the mid sagittal plane. Whatever lies near the mid sagittal plane, this is the mid sagittal plane. Whatever structures are lying near the mid sagittal plane, it is called as the medial. And the surfaces which are lying far away from the sagittal plane or the mid sagittal plane, we can call them as lateral. So the stuff which is present near the mid sagittal plane is called as the Medial parts, and the parts which are lying away from the body is called as the lateral parts. Then you have again two terminologies, that is proximal and distal. The proximal part is basically just the medial part. It is same as the medial part. Proximal means towards the center of the body, towards the center of the body, and distal means away from the center of the body. This is just away from the center of the body. That's it about this terminologies. So here you can appreciate in this image that this is the superior part. The upper part is called as the superior part. This is basically the midline of the body. Surfaces present near the midline called as the medial surfaces, and surfaces which are present away from the midline are called as the lateral surfaces. Surfaces which are present inferior to the body are called as the inferior surfaces. Then you can see that this is proximal and this is distal. Proximal means towards the midline of the body or towards the center of the body. And you can see this distal, which is away from the body. You can see superficial, which is present on the surface level, which is basically towards the skin side. It is called as the superficial part. And the part which is below, underneath the skin, deep inside, it is called as the deep part. So we learned about the superficial and the deep part. Now we'll see what is cephalic and condyle. So the cephalic part is basically towards the head region. Cephalic, this refers to the brain. So whatever structures are present near the head side, it is called as the cephalic part. And what are present near the tail region are called as the caudal part, because we refer tail as caudal only. So we have another terminologies, that is laterality. In laterality, we will just see the images first and then we will move on to the definition part. So see this image. What is this? This is unilateral. What does unilateral means? Unilateral means only one side of the body. If only one side of the body is visible, it is called as the unilateral part. Now, in bilateral, both side of the body is visible and is divided into two equal halves. So it is called as the bilateral part. Then there is another term, that is ipsilateral. In ipsilateral, everything, the body organs are present on one side of the part, which is on the unilateral part. Then it is called as the ipsilateral. On the unilateral part, if both the organs are present at the same side, then it is called as the ipsilateral. If the organs are present on the different side of the body, which is divided into two equal halves, then it is called as the contralateral. This is contralateral. So here we will write the definition. What is unilateral? Present on one side of the body, one side of the body, that is unilateral. In bilateral, it is present on both side of the body. It is present on both side of the body. In ipsilateral, on the same side of the body. If the organs are present on the same side of the body. And contralateral, that is if the organs are present on opposite side of the body, opposite side of the body. After lateralities, basically we are going to see the anatomical movements. What are anatomical movements? The movements that you are doing in your basic life is called as the anatomical movements. Whatever your body structure moves. So here are some anatomical movements. First is the flexion. What is flexion? Whenever you reduce the angle between joint or between two organs, then it is called as a flexion. So here you can appreciate, this is my arm. In my arm region, now this is the angle which is present. You can see, And whenever I am reducing this angle, then it is called as the flexion. Flexion is basically decreasing the angle of the joint. And then there is another definition, that is extension. In extension, in another movement, here the angle is already reduced. So whenever I am trying to increase this angle, look, the angle has been increased, then this is called as the extension. Whenever we increase the angle between joints, between organs, then it is called as the extension. Flexion is basically the bending part, and extension is basically the stretching part. Then there is another movement, that is abduction. Abduction is away from the body line of the body. Away, it is called as abduction. And whenever any body part comes towards the body, then it is called as the adduction. So in this image, you can see basically what is adduction, what is abduction. This is adduction, where the palm, where the limb is moving towards the midline of the body, then this is called as the adduction. And you can see abduction as well, whenever the limb is moving away from the midline of the body. This is the midline of the body. And if the structure is moving away from the midline of the body, then this is called as abduction. So there is another terminology, that is pronation. In pronation, the movement of the hand and the forearm is in such a way that the palm is facing towards the ground, then this is called as pronation. Whenever the movement of the hand and the forearm are in such a way that it brings the palm towards the ground, then it is called as pronation. Here you can appreciate the pronation with this image. This is pronation. Look, here the palm is facing towards the ground. And the another part, it is supination, another movement. So in supination, the forearm and the wrist moves in such a way that the palm is facing towards the upper side, then it is called as the supination. Here you can see basically the palm is facing towards the upper side. It is called as supination. The another movement is circumduction. Circumduction is basically the cluster of various movements, that is flexion, extension, adduction, abduction, in such a way that it completes a circle. Then it is called as circumduction. You can basically appreciate the circumduction in this image. Look, here you can see the arm is basically fully rotating. Here the arm is rotating. But in next image, you can see that this body, this person is doing all the movements, which is adduction, abduction, flexion, extension, in such a way that it creates circular motion. Then it is called as circumduction. Then we have another movement, that is ulnar deviation. When the movement of wrist is towards the midline, then it is called as ulnar deviation. And when the movement of wrist is away from the midline, then it is called as radial deviation. We will learn this with a diagram. Here we can see that this is the diagram of hand that I'm drawing here. So the fingers, this is the whole hand. The bone which is lying towards the thumb, this is called as the radius bone. And the bone which is lying away from the thumb, that is called as the ulnar bone. So here is the midline that we can appreciate. In ulnar deviation, the movement of wrist is towards the midline, and in radial deviation, the movement of wrist is away from the midline. Then we have another movement, that is opponents and reposition. What is opponents? You can appreciate this opponents in image I'm showing you here. So this is basically opponents. Look, Whenever the thumb is trying to reach other finger, such as this little finger, ring finger, middle finger, index finger, then it is creating a movement that is called as opponents, that it is showing opposition to the all fingers, then it is opponents. And another movement is reposition. Whenever this finger, this thumb is coming back to its original position after doing this opponents, it is called as a reposition. You can see this. This is reposition when the thumb is coming back to its original position. These are these movements. After that, we have another movements, that is elevation and depression. Elevation and depression you will see in scapula. Basically, you can appreciate in this image that this is the scapula, and the person is moving its shoulder in upper direction. That is the elevation. And when this shoulder are moving in the lower direction, then it is called as depression. So this is the movement that we have seen here. After that, we have another movement, that is inversion and eversion. You will see this movement in the sole of foot. Whenever the foot, this is the foot, imagine this is the foot, and this is moving towards the midline of the body, then it is called as inversion. Whenever the sole is moving towards the midline of the body, it is called as inversion. And whenever the sole is moving away from the midline of the body, it is called as eversion. You can appreciate here I'm drawing the structure of leg. This is basically the leg, and this is basically the foot. This is leg, this is foot. The upper part of the leg, this is called as the dorsum, and this lower part of the foot, it is called as plantar. For explaining the other two movements, I need this diagram. So here is dorsiflexion and plantar flexion. Whenever the angle between the dorsum of the foot and the leg is reduced, I have told you what is flexion. Whenever the angle between the joints are reduced, then it is called as flexion. So whenever the angle between the dorsum and the leg region will reduce, then it will call as dorsiflexion. And whenever the angle will increase, it is called as plantar flexion. So the confusion might create that when the plantar region is moving downside, so it should be called as dorsal extension, but it is not called as dorsal extension because the plantar region is trying to reduce its angle in respect to the posterior part of the leg. So it is called as the plantar flexion and not dorsal extension. So remember this. And that's all for today's lecture. See you in next lecture. In part 3, we will be discussing more about the general anatomy terms, and the series will be completed in almost 10 lectures.